The acdc project's an initiative of Community Mental Health Australia, and we've done it in every state and territory across the country at 26 sites, and it's been a great way of connecting with people in a novel approach that we call proactive outreach.
Proactive outreach is bringing wellness to the householder's doorstep instead of them going by themselves to access the service.
As a people connector, I engage with vulnerable populations by having meaningful conversations, asking general questions about their health and well-being.
I found that too many people did not have information about what services are existing in the community.
So what's unique about the acdc project is that it takes a preventative approach. The people connectors are able to meet the householder before they get to that crisis point.
Sometimes people need that push to speak to someone.
Based on what they have shared with us from their lived experiences, that gives us valuable information to connect them to the right services.
Many householders are really in need of someone who can support them socially and emotionally.
And speaking to them can make their day, just checking up on them, because people really check up on each other.
One person that they could help that day just made their day at work and made a difference as well. And for them, the acdc project wasn't a project, it was a passion that they have.
What I really enjoy about being a people connector would be the stakeholder engagement perspective, connecting with different services to local householders.
We also attended community events so people are more aware of our project and also to connect with these services to help out the community. So to be a good people connector, you just really need to be yourself, to be empathetic, to make the householder feel comfortable, to actively listen, to make sure your body language is in a good position and showing them you have your full attention, and creating that safe environment for them to open up.
acdc empowered me too, because I can approach anyone, any stranger. I developed a skill how to talk with that person and how to read that person's mood.
So we do a week's training, and that's really helpful, and we focus particularly on how you establish rapport quickly in the first 5 seconds to develop confidence, how you listen, and particularly it's really important that there's no agenda. We're not trying to do anything, we're not trying to sell anything.
The most challenging thing about being a people connector is breaking the cultural barriers for householders to open up.
Working with services who work in silos, finding ways to work in a collaborative manner.
We met a householder that couldn't leave the house for over a month. The people connectors created such a comfortable environment for him to open up, and he shared about his personal experience. The next following week, he went outside of his house and spoke to the people connectors and was very appreciative and grateful because he hasn't had a conversation in such a long time, and he also hasn't left the house in such a long time.
I felt very safe delivering the acdc project through the support of the Community Mental Health Australia team, our line manager, and also our trainer. We are well equipped to work with people from diverse and high care mental health needs.
It's life-changing. Sometimes, like when you go into a householder, you just don't know who's behind that door, who's going through issues. Also, you helping and having that compassion to help people is very, very rewarding.
The people connector role is an essential part of proactive outreach, and proactive outreach should be a component of all future funded mental health and wellbeing services. It's demonstrated it's necessary to do something like that to connect with all the people who need and would benefit from those services. Else there's a vast number of people out there who are isolated, who you'll never connect with.